If you have chronic pain, then maybe you're just really good at feeling pain, which isn't the best superpower, to be honest. But this is what happens to people with chronic pain, is their brains become sensitized to it, especially in a certain area, often just throughout the body though. Which means you basically, it's not what you want really, you just become better at feeling pain, which means more things hurt, and it doesn't take as much to feel that pain. Like I say, these are physical brain changes that occur with chronic pain. So it's been known for a long time that the pain you feel, especially with chronic long ongoing pain, isn't always related, or is hardly ever related to the physical condition of that part of the body. So for example, someone can have a lot of wear and tear, a lot of arthritis in their spine. I'll show you an example here, but they can feel okay. And some people can have minimal wear and tear or none and be in pain all the time. So here's an example. These are some healthy vertebrae with a nice big chunky disc there and lovely smooth edges on the bones. And these are very arthritic vertebrae. Now, if you looked at that on an MRI or an X-ray and someone had back pain, you might assume that this is where it's coming from. But it's not always the case, because like I say, some people can have spines like this, and they'll be stiff and they might be a bit achy, but they're not in severe pain necessarily, because that chronic pain is being felt in the brain, not in the spine or the knees, wherever it is. So pain sensitization is an important thing to take into account when you're helping people who've got chronic pain. How do we desensitize you from chronic pain? Well, there's 4 things really that work, that we use all the time. The first one, of course, being chiropractors, is chiropractic adjustments. Now, it's been shown through research in the last few years that when we do the adjustments to the spine, as well as freeing the joints up and getting fluid going into the joints, which helps to repair it, what that does is also desensitize the nerve endings, or rather desensitize that area of the brain that feels those vertebrae, so that it just hurts less. And often over a course of treatment, you'll find that people who came in very, very sensitive to touch, for example, actually become far less sensitive and are able to tolerate a lot more physical hands-on work, as well as a lot more day-to-day activities. So chiropractic adjustments work really well for this. Acupuncture is another modality, is another treatment that we use here a lot, often combined with chiropractic adjustments. And one of the reasons I really like acupuncture is because it's non-invasive. Well, it kind of is invasive because you're sticking pins in people, but it's non-invasive in the sense of, compared to, say, deep tissue massage, which is fantastic for some things, but if somebody's very, very sore, it's not appropriate to do really deep tissue stuff on them because you'll just aggravate it. Whereas acupuncture is very comfortable, very user-friendly, but it really helps to desensitize that area. So I'll often do that with people when they first come in, if they can't tolerate any kind of heavier treatment like pressure point therapy and that kind of thing. So chiropractic adjustments and acupuncture. And another one that's really important is movement and exercise. So what you're doing, even if you have to plow through the pain, what you're doing is teaching the body that it's safe to do those movements. Now, of course, there's a fine line, and you've got to be sensible between, there's a difference between it aggravating it a bit and really giving you warning signs like, no, your body's telling you I do not want to do this right now. Normally, though, when that's the case, that's with an acute injury. So there's a lot of inflammation, there might be instability, like if you sprained an ankle, for example, then you don't want to go plowing through and just forcing yourself to exercise at that stage. That's not the time for it. But if we've already assessed you and said, no, actually these movements are safe, you're not going to cause any physical harm, there's no damage occurring at all, it's just your brain being sensitive to this movement, then you'll have the confidence to go and maybe go for a walk for a bit further than usual, or do the housework even though it's causing some discomfort. And the more you do this, what you'll find is your brain becomes tolerant to it, and it starts to push the envelope of what it thinks is safe, because often that's part of the whole pain thing, is what your body senses that something might be a threat to it, so it's just kind of keeping you away from that. So yeah, exercise, movement, starting in whatever level's right for you. Swimming is often a good thing because it's less weight bearing, or even if not swimming, walking widths, which means getting in the swimming pool and just walking across like that in the shallow end, so that you're kind of using the muscles a bit more and taking the weight off the joints, but allowing your body to move, and then grading it up and then stepping it up. So chiropractic adjustments, acupuncture, encouraging movement, encouraging exercise, and also in some cases diet and nutrition, because more inflammatory foods like sugars, grains, for example, or anything you've got an intolerance to is going to cause inflammation in the body, which sensitizes everything. Sensitizes the tissues, the nerve endings, the central nervous system, so the brain itself. So sometimes people feel a lot better just from cutting out or cutting down certain foods, maybe artificial sweeteners, for example, or sugar. And again, sometimes this is trial and error, but there's a lot of different ways that we can approach this, and often it's a combination of things that gets the best results. So if you've got chronic pain, have a think about that in terms of pain sensitization. There's different ways of getting around it, there's different ways of improving it, but there is always hope. There's always something you can do. If you've got any questions about that, stick them in the comments, and hope to see you soon. Take care.